Okay, good morning. I'm here today to give you an update on the COVID pandemic here in the Murrumbidgee region. I'll start with some good news, news that everybody is hanging out to hear, and there are no new cases of COVID positive in this region as of 11 o'clock this morning. I appreciate this is an extraordinarily difficult time for all of our communities who are living at a knife's edge, where we are seeing outbreaks all around us in the cities and the rural areas that surround us. And it is a very, very difficult time for everybody. And I really wanted to come forward today to talk about what we are doing to ensure that we are as prepared as we can be, because it is inevitable that we will get an outbreak in our region. We've already seen travellers coming through our region and creating what we call exposure sites, and that's where people who are COVID positive come and stop for fuel or food, and we are able to then stand up quick testing facilities to make sure that there hasn't been community transmission. So just some data to start with. There's still 61 cases of COVID positive people in our region. We haven't seen a community transmission, I hate to say this and I would really like to touch wood, for nearly a whole year now in our region. Of that 61 people, sadly we have also seen a death, and 49 of those people actually contracted their disease overseas. And I love the way that my notes just flew away in the wind. Look, our people have been really fabulous in terms of coming forward for testing. So far we've done over 85,000 tests in this region. And we also run a COVID hotline where we take up to 2,000 calls a week to help steer people into both vaccination and steer people towards a testing clinic near them. We work very, very closely with our general practitioners and our pharmacies, because it is important in a rural area that we can combine all the resources that we possibly can. I want to talk to you now about what we're doing to make sure that we are ready when we get an outbreak in our region. And it all starts with sewage detection. I know that sounds strange, but that is a very sensitive indicator of COVID fragments in our sewage detection. And we are doing that continually across our region, and that gives us a very short window that something is possibly going to happen in our region, as we saw in Western New South Wales recently. So when we get that positive sewage detection, we know that we are really getting very close to having an outbreak in our region. Once we get a COVID positive case, we have in our region a public health unit. They do extraordinary work. I visited them just this week to thank them for the work that they are doing. They're also doing contact tracing for all of the Sydney region as well. And they are very, very clever virus detectives, if you like. But what is critical in that time is we do that quickly and we identify close contacts and venues of concern. Because once we know those, we can get those people into isolation. People who visited venues also into isolation and tested, and that's how we reduce community transmission. But we also do it in combination with vaccination, and I'll talk about that in a moment. So once we're onto the contact tracing, we are also ready to ramp up testing. Any outbreak anywhere across our 126,000 kilometres, we can ramp up testing in this region. Again, we do that in collaboration with a range of private providers who are pathology providers, and I want to thank them. They have been absolutely responsive and are brilliant partners to work with. And then we have our hospitals, because ultimately we've seen that patients can become severely ill and require hospitalisation. And we've broken that down into 3 regions and 3 sections. First of all, we know a lot of people with COVID positive diagnosis don't necessarily need to go to hospital, but they do need healthcare. So we have 2 ways of providing that. First of all, a hospital in the home for people who are reasonably ill and need that daily supervision from nursing and medical support. And then we have supported accommodation, where people who are not so ill and can't quarantine safely at home can go into accommodation where we provide them with hot meals, some welfare support and a daily health check. And then of course, increasing the activity in our hospitals for those who become severely ill and may need to be admitted to a COVID ward or ultimately into an intensive care unit for ventilation or higher level care. In Murrumbidgee Local Health District, that will only occur in our big regional hospitals. That intensive care support at Wagga Wagga and Griffith Base Hospital. We have tripled our capability to provide intensive care services so that we are ready. We also have COVID wards at the ready. It is important for communities where you have multi-purpose services or Murrumbidgee residential aged care. We will not be using those hospitals for COVID positive patients. We have to preserve at all costs the health and well-being of our frail and elderly. So also we have plenty of PPE, and that's important too. And look, I was again visiting our staff just yesterday who tell me that they are now very well used to wearing PPE. They've been doing it for 18 months now. It does sometimes slow down the process as they have to put on their full attire, but I want to reassure the community that we have plenty of stock of PPE. So we are doing all we can to make sure that we are ready for an outbreak in our region. So what can you do, people at home, to get ready for an outbreak? Well, the first thing is don't panic. It seems to be human nature that we all race off to the supermarket to stock up. But when there are stay-at-home restrictions, people can only leave home within their close vicinity to make sure they have adequate groceries and adequate health care. So first thing is don't panic. Working from home becomes important, and really only exercising for the short periods of time in your neighbourhood. Our region has also seen people coming in to receive vaccination from far afield, and it's happened right across our region. That is not acceptable. We are working closely with police when that happens. We do not accept appointments from people who are from outside our region for vaccination. The orders do stipulate you may leave home for vaccination, but it needs to be as close as possible to where you are living, and that becomes then a reasonable test. Checking in and out is also important when you do need to leave home, even now. And again, our community have just been fantastic in checking in and checking out. That helps my guys, our contact tracers, because they get that fantastic list to start calling and making sure that we identify those appropriate venues. Social distancing and adherence with our rural and regional orders has again been pretty good compliance across our region, and Superintendent Noble will speak to you in a moment about that. But generally our communities are vigilant. They are ringing Crime Stoppers if they think people are breaching the orders, and I do want to thank absolutely everybody for that. So please don't forget social distancing. Don't forget to get tested early. That's really, really important. And vaccination. The combination of vaccination and the public health measures that I've just outlined to you today is what is going to get us out of this situation that we all find ourselves in right now. Vaccination is critical. The rates in our region for first vaccination sit between 43 and 45% first vaccination, and 17 to 18% of our population are fully vaccinated. We need to get those rates higher than that. That will be our way out of this pandemic. We will probably always need public health measures to help us manage containment of this virus. You can get vaccinated right across our region through pharmacies, GPs, and through the Murrumbidgee Public Health Vaccination Clinics. If you get vaccinated, we can tell you that if you contract the disease, because contact will happen sometimes, no vaccine is 100% perfect. But if people do contract the disease, you will get less sick. You will reduce the need to go to hospital, which will reduce the burden on the health system. But you will also help to contain the disease by not spreading it to other people. So I can't stress highly enough the importance of anybody over the age of 18 coming forward for vaccination. And finally, just for pregnant women out there, it has been a really confusing time for pregnant women with different advice coming forward from different agencies. But now it is very clear, it is really important for pregnant women to come forward and have a Pfizer vaccination at any time in their pregnancy. They have been prioritised in the Australian government eligibility criteria in category 1B. So please come forward. We know pregnant women, if they contract COVID-19, will get a more severe outbreak of the illness and can possibly get complications in their pregnancy. So please feel comfortable to come forward, talk to your doctor, talk to your midwife, and please get vaccinated. And finally, I know how difficult this time is for each and every one of you out in our community. Waiting and that feeling of foreboding. So I really want to encourage people, if you're not feeling comfortable, think about being kind to each other. Seek help if you need it. The Beyond Blue mental health access line is absolutely fantastic for having a chat with somebody who knows and can help. That number is 1800 512 348, and you can also chat to people online. Let's look after each other in this very, very difficult time, and know that we will probably have an outbreak here at some point in time, but we are doing all we possibly can to be ready. So I'm going to hand you over now to Inspector Bob Noble, my colleague. We work very closely through Bob's Regional Emergency Management Committee, and I just want to thank Bob Noble and all of the people who are in the local councils, because we are working together here for a whole of government response to COVID-19. Thank you, Bob.
Thanks, Jill.
I'll pick up this telephone.
Otherwise I'll step on it.
Yep, thank you.
Thanks very much. I just want to pick up probably where Jill left off with the notion that, yeah, there might be people out there doing it tough. I've got several functions in supporting Jill and her team and the other parts of the health apparatus in terms of the pandemic. First of all, obviously, is as a police officer in enforcing the public health orders, but I have a role as the Region Emergency Operations Controller. And in March last year, I wrote to all the other emergency service organisations and the people who form part of that Emergency Management Committee, which health is a part of, and I signed off that invitation to the first meeting that we had by saying, I think we all need to dig in on this one. And I'm not embarrassed to say that even I totally underestimated the length of this campaign and how much we would have to dig in and how much resolve would have to be shown by all of us, and by that I mean the entire community, in getting to the end of this. And a lot of people have suffered greatly during this last 18 months or so of the pandemic, and they continue to. And yes, plenty of people, across the community have become very sick and lost their lives. We're fortunate we've been well served, firstly by our remoteness out here from the metropolitan areas, but also very strong arrangements around health, but also a very fair-minded and to a certain extent I would say compliant community that will do the right thing in the interests of keeping everyone safe. So we've been very well served, but people do continue to do it very hard. A lot of people have suffered financial losses. A lot of people have suffered mental illness and doing it pretty hard. There have been family issues. There certainly has been, at times, spikes in domestic violence and other forms of crime. And as I said, I probably underestimated back then the scope and the nature and the scale and the length of this challenge, which we're not at the end of. But I do think there's starting to be a bit of light at the end of the tunnel, and surely one of the ways to reach that light at the end of the tunnel is through vaccination. Obviously, vaccination's a personal choice, and it is something that families and individuals should discuss and consider. But the evidence, to my mind, strongly points very strongly that vaccination is the way back to a more normal way of living. So I would encourage anyone thinking about being vaccinated to do it. If they've been procrastinating, they should embark on that course of action as soon as possible. And also, obviously, it's really critical if people are suffering symptoms or they've been in an area they might have been exposed to the virus to get tested. And there are, around the Riverina and the Murrumbidgee area, plenty of arrangements, plenty of sites where they can go and have that done. The Region Emergency Management Committee, which is comprised of obviously myself, other emergency service agencies, functional areas including health support and other support and non-government agencies, is working in support of health in combating the pandemic. We have been meeting regularly since March 2020, in most cases virtually, as you'll understand, given the nature of the issue. It's a very broad committee. It also includes local government, state government people, mayors and general managers of councils, and we've been continuing that recently, and there are several initiatives from the Regional Emergency Management Committee afoot now to support health around planning, because as Jill suggested, it is inevitable there will be local transmission, such as the nature of a virus. We hope to get into a state where vaccination levels are high enough to be able to cope with that, but we are doing certain things to get ahead of that should it transpire and when it transpires. I won't go into what they are, but it's sufficient to say that they're around combating large numbers of cases in support of health. So rest assured that the local government, state government, federal government and your emergency service organisations are planning ahead to support health when things get a bit more difficult. As I say, we've had a good run, and that's generally around compliance, people observing the health orders and doing the right thing and doing those necessary things around hygiene, social distancing, curtailing unnecessary travel and so forth. So that's really where I will leave it, other than again to pick up on what Jill said. We know there are people out in the community doing it tough. This pandemic has been hard on all of us, and those people that live in the margins or maybe by nature of their day-to-day lives are isolated are probably feeling that's exacerbated now. There is help out there if you are suffering. You should reach out. There are there is Access Line, there is Beyond Blue, there is Lifeline, there is your GP, but in the first instance, just turn to someone that you can talk to. There is always someone that will help, and if the first person you do reach out to doesn't turn out to be the right person, ask someone else. There is always someone willing to help. It's a hard time on everyone. Let's not make it harder by not reaching out for help. And also appropriately, if you're aware of someone that may be suffering, that may be isolated, and you think you can reach out to them, you should surely do so, because quite often that person that is suffering is just waiting to be asked if there's anything to be done for them, and they're ready to tell their story. So I would encourage you to reach out to someone if you think they might be struggling. So I'll leave it there. Is there any questions of me, and then I can hand back to Jill for any questions? Then, yes.
Is there any more treatment since we last spoke?
Yes, I thought you might ask that. Look, obviously there's a law enforcement operation that runs concurrently to the emergency management components and also the work that health does. And yeah, we do continue to see some infringements by people that wish to not obey the health orders. Look, I'm pleased to say in the last 24 hours, we haven't detected any more offences that required infringement notices to be issued, but we did issue 5 more infringement notices in relation to a party that was held at a tertiary education institution in Wagga late last month. I'm sure most of us that have watched news in the last few days have seen images and video of that party, if that's what it was, and in the circumstances, without excoriating the young people depicted in that video, I'm sure most people would agree that that was entirely irresponsible behaviour, especially in the context of what was a growing outbreak in Greater Sydney. It was risky behaviour, and another 5 persons have been issued with $1,000 fines in respect of that incident since yesterday, or yesterday evening I should say, which brings to a total number of 18 persons that have been fined in relation to that, and our inquiries do continue, and there may well be more people issued with fines arising from that. The police today and in the weekend coming and the following week will be checking indoor places, particularly where people gather, with a particular focus on large indoor shopping centres and your other places where people might gather where there's a high risk of transmission. We'll be doing that in an overt fashion in uniform. We'll also be doing it in plain clothes, and it's not a matter of being sneaky, but it's a matter of making sure that people don't become complacent. And we also want to support business owners and local government and health in their enforcement and discharging their obligations around health orders. People that manage those facilities have to ensure that people check in using the QR code. They have to ensure that people wear masks where that's mandated as part of the order, and they have to ensure certain other things happen. And the police want to support those proprietors and those organisations that manage those facilities in ensuring that occurs. We understand it's very difficult for people, particularly that are engaged in a mercantile or business undertaking, to do all this extra work, but that's an unfortunate cost of doing business in the current context. If we can get those vaccination rates right up, we're likely to be at the other end of it more soon, and that should alleviate a lot of that extra cost and the burden of doing business.
What about on the roads? We've seen that there are numerous cases in areas that are now locked down in New South Wales.
Yep.
And also
Yes, we are. We are patrolling the highways and also the minor roads quite intrusively, using high patrol and general duties police and also plainclothes police. We will use the number plate recognition technology to detect vehicles from any of those locked down areas. We will stop and check the bona fides of people in those instances, also in and around the service stations, the places where people stop, caravan parks, informal camping sites, and so on, to make sure people are doing the right thing. We do receive via Crime Stoppers and via direct contact to police reports of people that people suspect are doing the wrong thing. We do assiduously follow those up, and quite often we do detect someone doing the wrong thing. And there's not too many circumstances of mitigation that would cause us not to issue a fine to a person who's left one of those hotspot areas and travelled here knowing that it was the wrong thing to do. No, we don't like hitting people in the hip pocket, but if that's what's necessary to ensure compliance, of course we do that, and it's just part of the way we do business. So whilst we derive no pleasure from it, we get some satisfaction out of knowing that we're doing all we can to support health and keep people safe.
In regards to the ACT lockdown as well, if anyone was in the ACT since the 5th of August, they do have to complete the 2 week stay-at-home orders. Is there a way for you to know people in the Riverina or Murray region have been in the ACT, and how are you policing that?
Okay, so health provide us every 24 hours with a list of people that they become aware of. That's a master list that's up, as I say, it's refreshed every 24 hours, and police go out and perform compliance checks on each and every one of those addresses. So it is, yes, very intrusive, but it's something that's necessary. We do it in a supportive fashion, and especially if the person's at home doing the right thing, we do ask as to their welfare and so on, and see if there's anything that we can do to support them. But we do receive those lists. Obviously, there will be people that have travelled in and out of the ACT that we're not aware of. The onus is on them to do the right thing. If they're shown to do the wrong thing, they will face a sanction. So, look, really, the key to so much success that we've had across this district in keeping COVID out is people voluntarily doing the right thing. I see no reason to doubt the virtues of the people of this area, that they'll continue to do that. The odd person that doesn't, there's probably every chance someone will notify the police or the health authorities of that, and we'll be knocking on their door. And if they're not home, we'll find out where they are and ensure they are returned home, and they'll probably be lighter in the pocket into the bargain.
And that master list, is that from
Sorry?
the master list? Where does that info come from?
Well, it comes from health, and it comes from a variety of sources, obviously, yes. I mean, obviously the QR codes and so forth form part of that. It's a comprehensive database. It is used, obviously, to ensure that people, when those areas are identified, sometimes they don't know they've been into an area, you know. I mean, they might go a day or two without knowing. So, you know, health chase those people down. It's a big job. They do a fantastic job at it, and I've seen them in action. The job is getting bigger, obviously, because there are more and more cases across the state, but it's compiled from a variety of sources. But ultimately, as I say again, particularly for the people of this region, they generally know if they've been in an area that's identified of concern, and most people are trying to do the right thing, and that reinforces how lucky we are to live in this part of the world.
So just on that, what are the rules in terms of school children who've been in those areas that are subject to stay-at-home areas? Are they exempt to attend school?
I don't know. I'd have to read the health order in detail, but I think, you know, this is a dynamic and changing situation, and you have to consult the health order, such as it probably will be revised today. So sorry, I can't comprehensively answer that. Okay. Any questions for Jill?
For Jill, yeah.
I wanted to quickly ask, there's, the last 24 hours, there's been so many rumours about potential case in Wagga, potentially going into lockdown. Did you want to clear that up for everyone about where we're up to right now in terms of that?
So as of 11 o'clock today, there are no new positive COVID-19 cases in the Murrumbidgee region. And I appreciate, yes, there are rumours in many towns about COVID positive cases, but I think the most important thing to reassure people is that we will let you know.
Do you think that might be why there's such high testing numbers today as well? The lines are quite lengthy.
Yes, that's right. So I think the closer outbreaks come to us, and obviously hearing about Western New South Wales, it just goes to show that really within a couple of hours the situation for us could change, and then we saw obviously Canberra on the back of that. So we feel now that it is all around us, and it is an uncomfortable situation, I think, for everybody.
So you do sound quite resolute, you know, that it's under.
Sorry, can you just, now the truck's gone, repeat that question so I can hear you.
So you do say that it is getting more of an outbreak. Can you just summarise for me why that's
Well, I guess I need to be prepared for the worst, and when we've seen how the virus, which is highly infectious, is actually spreading around into regional areas, I'm doing all I can just to be sure that we are ready if it comes here. And given the rate of transmission and the rising numbers, I am just surmising that it is going to probably come here.
Can you outline just sewage testing in a little bit more detail? How often does that happen? And is it in every local government area in our region? How many?
So the sewage testing, as I previously said, is a highly sensitive tool for us to have some preemptive knowledge about COVID fragments in sewage water. It happens in about 6 of our regions across the district. So Albury, Wagga Wagga, Griffith, Deniliquin, Gundagai and Moama. We can't do absolutely every local government area across New South Wales. That would put an enormous impost onto our testing laboratories. But that gives us enough indication across our region and a really good high surveillance of what's going on.
And are you aware of the public health orders when it comes to school children being in any of those areas?
I would also need to go and read the public health orders, as Inspector Noble said, change regularly.
And can you just clarify your comments in regard to urging anyone over 18 to get vaccinated? That applies to people in regional areas as well, such as here in the MLHD, not just those who are in hotspots who are greatest.
Yes, that's right. So people can go online through the eligibility checker and check their status, but you can book a vaccination for anybody over the age of 18 in our vaccination clinics. Correct.
We've seen in Western New South Wales particular concern around Indigenous communities now that there's been a case identified in Walgett. What sort of efforts is MLHD doing in particular in the Indigenous communities in our region, given the experience that we're seeing in Western New South Wales?
So any risk to the health of our Indigenous populations is an enormous concern for all of us. And we have been working very closely with our Aboriginal communities on their community action plans to ensure that there is action from within that community with support of government to support them in making decisions such as locking down their communities. So for instance, we've been working recently with an Aboriginal community up in the northwest of our region, and it's really important that we all work together. So yes, there is a lot of work going on.
What about in terms of vaccination? Because that's one of the issues in Walgett is the low vaccination rates. How are you tracking in terms of Indigenous vaccination in our region?
So the vaccination data is published by the Commonwealth Government, and I encourage people to get online and have a look at it. That's the way I access my data as well. But I think there's no one simple answer. The answer that I would give to your question is we need to work with every community and ask the Aboriginal people how we can assist them to improve their vaccination rates. And putting it simply, I think it's important that we take vaccination to Aboriginal Indigenous communities rather than expecting them to travel to get the vaccine hundreds of kilometres. So that's certainly work that we are doing now in collaboration with the Primary Health Network, GPs and pharmacies.
Just back to the lockdown preparations, obviously worst case scenario, but when a case does pop up here, will it just be the one that might send Murrumbidgee into lockdown, or will it be, a certain thing of 10?
So fortunately, I'm not the person that would make the decision about stay-at-home orders or public health orders. Our New South Wales government, taking advice from the Chief Health Officer, makes those decisions, and then Bob and I enact them. But I think what we've seen in other communities, both in northern New South Wales, Hunter New England and western New South Wales, is when they had very low numbers, that people were quick to act to get those public health orders and getting people to stay at home. That actually gives us time to get our contact tracers onto the job, identifying close contacts, getting them into isolation and identifying those venues of concern. It just gives us that window to get on top of the contact tracing.
Do we know how many people in the MLHD are at home in self-isolation from being a casual or close contact somewhere?
I would not have access to that information, and because we are now working cross-jurisdiction with Victoria and also ACT, I think that number would be quite difficult for me to determine. Thank you. Thanks very much for your time.
Sorry. In terms of the wait,
Last question.
in terms of the wait times with testing, is there any plans to recruit more staff to help with processing those tests?
Yeah, thank you. And we can scale up our testing as we need to. And, you know, for example, where we have a 2-lane drive-through testing centre, we can increase to 3 and 4 lanes. So absolutely, we can accelerate scaling additional testing capability. Yeah.
And is there any plans to recruit more staff numbers?
So we are in advance of that recruiting staff all the time. So we've gone out and recruited a whole lot of casual workers. We've actually finished onboarding them. They are here and they are ready to enable us to be able to, as I said before, scale up that testing straight away. Thank you. Thanks, everybody.